Hi, I'm Dr. Sally Primus. I'm a board certified ophthalmologist with Hometown Ophthalmology and the Dry Eye Center of Evansville. This video is a part of a series where I go through many of the common dry eye treatments and I talk about how they work, how to use them. I'll even try some of them out right in front of you. I'll talk about whether or not you can get them on your own or if you need a prescription, whether insurance might cover it or not. And I'm happy to answer any questions. And if you want to learn more, you can check out our website at either hometownophthalmology.com or dryeyevansville.com. In this video, I want to talk about over-the-counter eye drops for dry eye. And I want to make it clear, I'm not saying there are certain brands that are the best, because there are many good brands out there. There's also many bad ones. So you want to avoid things like Clear Eyes, Visine, anything that says get the red out. And if you can buy it at the Dollar Tree, you really shouldn't put it in your eyes. But beyond that, I'm going to show you some of the ones that we sell here in the office and talk about the differences, but I'm not necessarily saying that these brands are absolutely better than other ones. So I'm going to start with the Refresh line of drops here. And Refresh is one of the more common drops, kind of like Sustain. They have multiple levels of their drops. So one of the ones I want to talk about first is their Relieva. Relieva comes in a bottle and a box like this. In the box, it's going to come in vials like this. What I'm telling you here applies to Sustain, TheraTears, other brands too. If it comes in a bottle like this, it almost always has preservatives in it. For people who have severe dry eye, you probably want to avoid the preservatives. You don't want something in a bottle with preservatives. But for most people, they're fine. You don't want to use them more than 5 to 6 times a day though. So if your dry eye is bad enough, you're needing drops more frequently than that, you really need to switch to a vial. So these are basically the same drop, but this is without the preservatives. The flip side is, once you actually open up one of these vials, like that, it's good for 24 hours. The clock starts. After about 24 hours, bacteria starts growing in this and you need to throw it away. The preservatives keep the bacteria from growing, but can be kind of hard on the eye. So same drop, preservative free. It's going to be a little more expensive, but it's definitely gentler. I like these because I can stash them. I have a few in my purse, a few at the office, plenty of them surrounding my house. And you don't have to worry about keeping track of just one thing, but both are good. The other thing that I like by Refresh is they have the Mega 3 drop. It has oils in it, so it also comes in a preservative-free version. But for people who their dry eye is caused by not enough oil being made by their eyelids, this has oil in it. If you only use the regular like Relieva drop, if you have an oil deficiency, your tears are just going to evaporate off. They're not going to last very long. That's a common complaint I hear from people. It's like, put the drop in, it feels good, but then a few minutes it's gone. Well, that's because there's no oil in it. So drops that have oil in it can make a big difference. And again, those are preservative free. And there's other brands that are just as good as those. For people who have a lot of oil gland dysfunction, a nice drop is called Retain. This has quite a bit of oil in it. And it also is preservative free. The company is very generous when they give out samples, and they give you usually 1 per box. But you get quite a few drops in there. And so this might not last you the full day. But again, more expensive, but you can see it's kind of white and milky. That is going to have quite a bit of oil and be quite soothing, but it will blur you. So don't put it right in before you go driving, or you might feel a little uncomfortable on the road. The next set of drops I want to talk about is an entirely different brand. And this is a brand that we sell in the office, and it is called Optase. It is very big in Europe. Europe is a little more strict, like FDA kind of wise. They're big on not allowing preservatives and bad things on the market. So the Optase products are going to be preservative free. They're starting to show up. I've even seen some of their products in Walmart, but we sell them here. You can buy them on Amazon. But I've been very happy with them. They're kind of my go-to drop when I'm treating my own dry eye. So I want to talk about a few things they have. They have a very good, just basic drop in a bottle. But the nice thing is it is preservative free. And you're like, well, how can it be preservative free if it comes in a bottle? The special thing about Optase drops is the bottle looks different. It's got a special cap, and inside that cap is a one-way valve. So when a drop comes out, nothing can reflux back. So bacteria can't get back in there. And this bottle typically has about 300 drops per bottle. So it should last you a while. So it's going to be more expensive than like the Refresh or Sustain you might buy in the store, but it tends to last a little longer because it seems to be more volume, and its smaller drop seems to come out when we push it. So the Optase Dry Eye Intense drops are, even though it sounds pretty high level, I would say that's kind of their regular basic level, but I really like those. Those are my go-to for my dry eye. They also have a new one called the MGD Advanced. That just means they've got oil in it. So like the Refresh Mega 3, it's a bottle with oil in them. And I've had some good feedback. Also preservative free because it's got the fancy lid. Another product they have that I've not seen anywhere else is they have a spray. For people who cannot do drops, they have too much trimmer, they're going to scratch their eye, or they just have too much fear of that. You actually can pop the tap off, you close the eye, go about 6 inches away, spray. I jumped a little because you're going to, but then it actually wicks into the eye. And it can be a great way of treating dry eye without actually putting a drop in the eye. I would not recommend this if you have really crusty, nasty eyelashes, but as long as you have nice, clean eyelashes, this should be just fine. And then the last thing I want to show you of their products is they have an ointment. An ointment can be used at night or just anytime you have a really bad flare-up of the dry eye. Refresh, Sustain, a lot of them also have what they call PMs or ointments. These are very, very good for protecting your eyes while you sleep, especially if you use a CPAP. And so if patients come in, they've got severe dry eye that's really bad in the morning, it often means their eyelids are not closing all the way or their eyes are drying out at night, and this can be a game changer. They might be just a little goopy in the morning, wipe it away with a tissue, but it kind of resets their eyes for the day. So there's a wide variety of over-the-counter products. There's a wide variety of what brands are safe. We're happy to give a list in person. I try not to support individual products and say things are good or bad as a whole, but those are a few of my favorites. So if you have any questions, just ask.